I would like to now introduce Adele Hite, the Policy Chair of the Healthy Nation Coalition. Adele.
Thank you, Sally. Thank you.
I would suggest holding this.
Okay. Good morning. I'm Adele Hite. I'm a PhD candidate in nutrition epidemiology at the University of North Carolina. And you've heard a good bit already this morning about the science that's out there and the fact that it's being ignored. So the question I think that we have to ask ourselves is why? I do represent the Healthy Nation Coalition. We're a public health advocacy group dedicated to changing the definition of healthy food. But I also represent all of those Americans who have tried to eat a healthy diet according to the USDA's definition and have become overweight, obese, and sick in the process. I was one of those people, obese and sick when I ate according to the guidelines. Before graduate school, I worked at a Duke clinic where I met a lot of people just like me, people who were struggling with their weight, poor health, trying to force their bodies to be well on a dietary pattern that has never been tested to show specific health benefits. This is from the Dietary Guidelines document itself. It's not been tested. Now, they show us the DASH diet and the Mediterranean diet. Those have been tested. Well, let me tell you that the versions of the DASH diet that reduce carbohydrate and replace it with fat and sodium work better. The Mediterranean diets that they point to as being so healthy have up to 13% of the calories as saturated fat. That's more saturated fat than Americans are eating now. In fact, that's how much Americans were eating 30 years ago, before we were given dietary guidelines. So the first dietary guidelines were released in 1980. After 16 years of following the recommended low-fat, grain and cereal-based diet, I was 60 pounds overweight, fighting to get my body back. So I did what I was supposed to do. I ate less and I exercised more. And I finally lost 15 pounds. I was also hungry and tired and miserable. You can ask my husband. And what's worse, I couldn't lose any more weight without starving myself. After a lot of research, I found, and the patients that I met at the clinic found, that when we ate foods that the USDA had been telling us not to eat, foods like eggs, broccoli with butter and salt, greens with fat back, because I'm from North Carolina, and even the occasional steak, we felt better, we lost weight, we got healthier. For the patients that I met with type 2 diabetes, this was even more remarkable. They could get their blood sugars under control. They could reverse the symptoms of diabetes instead of having their disease progress to loss of kidney function, loss of eyesight, loss of limb, loss of life. When they changed their diet to include fat, because they weren't afraid of it anymore, and to reduce the highly processed grains and cereals that the food pyramid is built on, they were able to reduce or completely stop taking medication. They got better, they lost weight. It happened time and time again. I saw it. It wasn't just me. It was all of these patients. And they wondered, like I did, why we've been told that the only way to be healthy is to follow the USDA guidelines. It's a diet that didn't work for me, it didn't work for them, doesn't work for many Americans. And one of those patients, and I'll never forget her, she said, Adele, you go back to school and find out why this is happening. And this is what I found out. From the start, our dietary recommendations have been based as much on politics as on science. The first set of dietary goals were written by political staffers, not by scientists or nutritionists. They were based then, that first set, on the as yet unproven theory that reducing dietary fat would reduce heart disease, diabetes, and obesity. They directed Americans to consume less fat, less sodium, less saturated fat, more carbohydrate, and these recommendations have remained remarkably consistent for 30 years. Americans have done their best to follow them. Mr. Satin referred to that clinical experiment that's going on with sodium. This was the first clinical experiment. It began 30 years ago. And here are the results. Any epidemiologist can tell you this does not look good. We have lowered our fat intake. We have increased our carbohydrate intake. When Mr. Satin says that the dietary guidelines didn't work, he's referring to sodium. So our sodium intake has not changed very much. It's remained stable. But yes, we lowered our fat and our saturated fat content. Yes, we increased our carbohydrates, just like we were told to. And what happened? Since the first guidelines, the number of Americans who are obese has doubled. The number of Americans with type 2 diabetes has tripled. So how did this happen? Well, if you look in the guidelines, the USDA blames our obesogenic environment. But the USDA created the policies that control nearly every aspect of our food environment. The primary mandate is to increase consumer demand for U.S. agricultural products. The primary promotional tool for U.S. food products is the dietary guidelines. They define healthy food, and it's this definition of healthy that shapes what consumers demand and what food industries provide. So thanks to these policies, cheap grain and cereal-based foods are everywhere, and they are marketed as an important part of a healthy diet. In the past 30 years, since the guidelines were released, the energy available from processed flour and cereal products and the added fats and oils in them has increased by nearly 200 calories, while the energy available from less processed foods, meat, eggs, nuts, fruits, and vegetables, has increased by less than 20 calories. Since the calorie increase in our diet over the past 30 years has come almost entirely from grain-based foods, many nutrition experts now agree that it's not just how much we are eating, but what. They believe that our low-fat diet recommendations have helped fuel our nation's health crisis. Yet, the USDA has disregarded the current scientific evidence and expert opinion, insisting that a healthy diet is high in carbohydrates. Well, I'm going to tell you why it's not. Humans have an inherent preference for sugary and starchy foods. That's from birth. The addictive mechanism that sets that in place has recently been clarified. We are not addicted to fat and salt. On their own, they have limited appeal, and they're biologically necessary. So think about it. If somebody gave you a stick of butter, how much of that stick of butter are you going to eat all by itself? Just a plate and a stick of butter. But fat and salt come with sugary and starchy foods. Add some bread to that stick of butter. Now how much of that butter can you eat? That's the difference. Dietary sugars and starches cause our insulin to rise. This encourages fat storage. It prevents fat burning. That is a biological fact. That's not opinion or bias. That's biochemistry. So when your fat gets stored and your blood sugar goes down and fat can't come out of the cells anymore, what happens in your body? You have no fuel. You're like I was, hungry, tired, but you're also still addicted. Chronically elevated insulin levels that can happen when you eat a diet that's high in sugar and starches are an independent risk factor for diabetes, hypertension, and heart disease. You don't have to get fat first. Scientists know this, but when the scientific evidence contradicts the USDA's definition of healthy, the USDA ignores the science. And why shouldn't they? There's no one policing the policymakers. There are no consequences to the USDA if the guidelines don't work. But there are plenty of consequences to us. This cannot be stated strongly enough. The dietary guidelines, because they are not based on objective scientific evidence, have caused harm and will continue to cause harm.